Hey guys, it's Dr. David here from El Paso Manual Physical Therapy. I am on live. I'm just clicking all the boxes on my software here so we can be live everywhere we need to be. There we go. We're going to be talking about hip arthritis today, and specifically, I'm going to give you 5 reasons why you should not focus on diet and nutrition to help heal your hip arthritis. So I'm going to be giving a teaching on my flip chart here today, and then I'll be taking some questions as well. And so I love this topic. I think it's a good one to talk about, and there isn't like clear rights and wrongs, but the points that I present, I think, have some good validity, and they're important to think about for your specific situation. It's not black and white. There's definitely some gray, but what you have to focus on is what matters for you. As I go through these points, just think about where you fit in. All right, so number 1, let's talk about the mechanical problem. And let me write that down. The number 1 problem, the number 1 reason why you shouldn't worry about diet and nutrition as something to focus on for healing hip arthritis is because in most cases, it's a mechanical problem. In other words, it's not like a diet nutrition focused problem. It's because of the way the joints moving, the cartilage, the movement from the muscles. And if you can fix that problem, then you're going to have the biggest impact on your healing for your hip arthritis. So the way that works, let me just show you here. This is a hip. This is the front. You're looking at the right hip. So this is the top of the thigh bone right here. And you have on the back side, glute muscles, butt muscles. And then on the front side, you have hip flexors. And the main mechanical problem that happens when it comes to hip arthritis is that there's an imbalance between the muscles on the back of the hip and the muscles on the front of the hip. And to be more specific, the glutes on the back, the butt muscles, they're way too weak. And when that happens, the hip flexors in the front of the hip, they pick up the slack, they compensate. They take up the forces needed, the stability needed. They do extra work to make up for those weak butt muscles in the back of the hip. And so when these hip flexors start to work extra inside the ball and socket joint of the hip, there's a shift in the forces. It pulls the ball forward on the socket and causes extra compression on the front end of the ball and socket joint where the surfaces contact. So when you get that extra compression, that's why you have lower joint space. That's why you might have a bone-on-bone osteoarthritis hip. And that's why you feel pain in the front of your hip, right? Where you feel it in the mornings when you're stiff and it's painful. If you've been sitting awkwardly for a period of time, or even if you just move your hip into a certain position, you can usually set off where it starts to hurt. It's because there's excessive contact there because the muscles on the front of the hip are pulling the ball forward on the socket, and your glutes don't have enough strength in them to properly align the hip joint in the center of the socket. The ball doesn't sit in the center of the socket. So that's the main problem here, that it's a mechanical problem. You don't fix mechanical problems by changing your diet and your nutrition. It's not going to make a big difference. You need to fix the way you move, the exercise, the strength. You need to get better butt muscle strength. That's a huge deal. I talk about that a lot. You have to get butt muscles working. In fact, one of the main problems that our clients run into is they can't even turn on their butt muscles. Like they'll be standing around like I am right now, or sitting or lying down, whatever position you're in. Try this out if you have hip arthritis, and just try to make your butt muscles tighten up. Like think about making your butt muscles squeeze. And if you can squeeze them, great, you're a leg up, no pun intended. But if you can't activate them, if you try to activate your glutes and your thigh muscles work, like I'm talking about your quads here, or the back of your thighs, your hamstrings, those are not your glutes. What are your thigh muscles doing activating when it should be your glutes activating? That doesn't make sense. That's called a compensation. One of those thigh muscles on the front of the hips, it's called the rectus femoris muscle. It acts as a hip flexor. It is a hip flexor, and it attaches right here on the front of this bone, and it crosses the hip joint, and it works with the other hip flexors, and it moves the ball forward in the socket. That's the compensation. So step 1 for a lot of people is just turn on your butt muscles. Just get them to activate, because they don't activate at all. Step 2 is going to be get your butt muscles to work apart from your thigh muscles. And then after that, you have to figure out how to activate your glutes and walking and standing and sitting down and exercise and your everyday chores and everyday activities that you do. You have to be conscious that your glutes are working for you. Otherwise, by default, your body's going to shut down the glutes and start to activate those thigh muscles and those hip flexors and push the ball forward in the socket and feed into the problem. That is the mechanical problem. All right, now that I've explained that, let me go on to number 2 here. It is hot today. It is humid. We've got a lot of rain here in El Paso. And so you're going to see me melting. I'm sweating. I sweat very easily. But sorry, you're just going to get to see that. So number 2 here is overweight. Distinguishing the difference between overweight and obese. Here's the thing. If you are obese, there's actual hard numbers that you can calculate to determine if you're normal weight, overweight, and then obese. And BMI is probably the one of the most commonly used numbers. It's great for large populations. And there's some problems with BMI. BMI is body mass index, and it has to do with your height and your weight. It's taking the ratio into account so that you can determine if you're the appropriate weight for your height. Now, you're going to know if your body weight is because of muscle or if it's because of fat. And if it's because of fat, that's not good. If you have a high body weight because you don't have a great diet and you've put on some pounds, some kilos, then you're going to be probably one of these. Now, if you're very muscular, you lift a lot of weights, you exercise regularly, you could have a high BMI and be categorized as overweight, obese, but it's muscle. That's generally a good thing. So just take that into consideration. Now, what I'm talking about, though, is if you are obese by the numbers, that means you have a lot of weight on your body proportionally. So if you're a short person, if you're 5 feet tall, you probably can't take more than about 30, 40, 50 pounds before you're considered obese. Now, if you're 6 feet tall, 6.5 feet tall, 40, 50 pounds, you can probably add on to your body and you're still considered overweight. Once you start approaching more like 80 to 100 pounds overweight, now that's going to put you in obese. So that's why it's a range. But the heavier you are, then the more it becomes important that you lose weight. And you got to look at your diet, right? You got to count calories, that kind of thing. Look at what's adding body weight to you. But here's the thing. If you're obese, tape this up for you and explain it. This is a pie chart showing the muscle imbalance problem is about a third. This is if you're obese. Diet and weight is probably about another third of your problem. And then nutrition and inflammation is probably the other third. Now, I'm just giving you this as my expert advice. I don't have any hard scientific research evidence showing you this. This is just how I explain it to my clients, and it seems to work. If you're obese, you still have a muscle imbalance likely if you have hip arthritis, but because 2/3 of your problem has to do with what you're eating and how much you're eating, it would probably be a good idea to focus on that because you'll have the biggest improvements if you lost some weight and decrease the inflammation because of the nutrition in your body. That makes sense at that point to not focus on the mechanical problem, the muscle imbalance, and instead focus on what you're eating. But what if you're overweight, which is quite a bit of people? Then it's going to look more like this. You see how the blue section, the muscle imbalance, is now a bigger percentage of the problem? Yeah, you still have diet and weight and nutrition and inflammation as part of the problem, but we're looking at about 30% of the problem being what you're eating and 70% of the problem being the muscle imbalance. Now, I'm not saying don't bother to lose any weight, don't pay attention to it at all. I'm just saying don't stress yourself out over what you're eating when In reality, if you worked on the muscle imbalance, if you got stronger glutes, figured out how to use them, you'll probably feel better in your hip arthritis and be able to exercise more and get momentum so that then you can better help your diet and your nutrition. But what if your normal weight, maybe even just like 5-10 pounds overweight, not that bad, wouldn't even be considered overweight, you'd be considered within the normal range. In that case, yeah, you could always improve your diet and shed off 5 pounds and help out with the inflammation, because maybe you have some processed foods that you really enjoy. They're your favorite snacks or something like that. I wouldn't stress out about giving that up as much as I would stress out about making the muscle imbalance a priority, because that's 90% of your problem at that point. Overweight and obese and then your normal weight, they are not, you have to have the right understanding of where you are here and then figure out which thing to prioritize. I would only stop focusing on the muscle imbalance if you're obese, because then that's when 2/3 of the problem is what you're eating. But most of the time, muscle imbalance is a big chunk of the problem. If you work on that, you're going to have some massive improvements. That's strengthening your glutes very often, amongst other things. That's just the most common part that people start with. All right, next one here. Got some comments on here. Let me just highlight some comments. We got Natural Emoja, it looks like from Jamaica. How's it going? Somebody said, Crazy Bacon said, hello, Dr. David from Canada. Hey, Crazy Bacon. And then we have Laura Greth says hello on Facebook. Fantastic. By the way, we're live on Facebook, on YouTube, as well as Instagram. I can't see Instagram comments, but I can definitely see your Facebook and YouTube comments, guys. And why don't you all say hello, whoever's here. I see 60 people, between 60 and 70 people on the call here. Let me know. Let me know if you guys can hear me and that you're here. Tell me where you're from. Let me keep going here. Number 3, we got Sugami Honey. I think I pronounced that right. It says hello. Fantastic. I'll get to some more in a second, but let's talk about number 3. Nutrition. Connected to inflammation. I think there's 2 M's. Inflammation. Here's the thing with this is when this is something that people get hung up on, because the difference between diet and nutrition. Oh, we got a few more hellos here. Let me just acknowledge you guys real quick. Cindy Castillo says, hello, Dr. David from Dallas. Hear you great. Fantastic. Thank you for letting me know, Cindy. Mountain Girl and Bunny says, Oregon here. All awesome. Can't wait to visit Oregon one day here. It's beautiful. Trisha Tucker, Ontario, Canada says hello. Fantastic. And then DSAP from SoCal says, thanks for the info. You're welcome, DSAP. All right, let me keep going here. So how nutrition connects to inflammation. I just want to distinguish how this works. Nutrition is like the micronutrients. If you think of macro versus micronutrients, macronutrients are going to be like your fats, carbohydrates, proteins, the things that make up the calories. Those are your macronutrients. That's why you hear people say, I'm counting my macros, or saying I'm counting my calories, and specifically looking at how many carbs and fats and proteins you're taking in. But then micronutrients are going to be like the things that you would supplement for. So like your sodium, your potassium, iron, all those other usually minerals and vitamins that people take. Those are going to be your micronutrients. There are some micronutrients that are in your food. So I'm thinking about like processed food. Those artificial chemicals that you hear about are like the food coloring, the red 40, those kinds of things that can set up inflammation. You absolutely have a connection there. Like undoubtedly, I believe that wholeheartedly. And I agree that you probably should cut that stuff out of your nutrition as best as possible. Realistically, you might be in a social situation where you have to have a soda or a cake, if you're at a birthday party, and you're taking in something that's going to cause some inflammation. Like it's just inevitable that you're probably going to run into some food around you that's going to cause inflammation. If you live your life worrying about that all the time, it's a stressful position to be in. And I think considering this chart here, when the red is the nutrition, it's a tiny bit of what you should actually be worrying about. If you're worried about the muscle imbalance, you're likely going to be very, very happy, and you can take having that cake or that soda or that candy bar or whatever it is, that occasional treat that you like, that you know isn't going to be healthy for you, you know is going to have some bad nutrition, is going to lead to some inflammation. But if your muscle imbalance is taken care of, you'll be okay. You don't need to worry about that part of nutrition. All right, we got a few more hellos here. Pamela Parties is in NYC. Hi, Pamela. And then we got Laura Greth, no comments. And then Pat Lynn says, I watch you all the time on YouTube, especially about torn meniscus. Oh, fantastic. I see some questions coming in too, guys. I'll get to those here in a moment. Let's just go on to the next one. I got 5 points here. Number 4 is diet and nutrition. I'm just going to write NTR. Doesn't fix. It's like a no. Movement. Sorry for my scribble. But diet and nutrition does not fix movement. A lot of people focus on this so much. You know, I got to cut out all the processed foods. I got to lose some weight and count my calories, my macros, and get my weight down. But what's missing when it comes to the hip, even if you do have the strength, because you got to get the strength first in the glutes in order to fix hip arthritis. But then after that, you've got to learn how to use the muscles right. Because there's people that are very strong that come into my clinic, people in our programs that are pretty strong, but it hasn't clicked in their head yet how to walk right using your glutes. And that's critically important because you take steps all day long. You take thousands of steps all day long. You very likely take anywhere from 1,000 to 10,000 steps in a day, possibly more, maybe occasionally a little bit less depending on the day. But on average, you're taking thousands of steps. If 80% of those steps could be good quality steps with the right muscle activating, the glutes activating, then you're setting yourself up for proper movement inside the joint, which can heal. Now, we have to get beyond the fact that this is not an age-related condition. I strongly don't believe that's the case. That's just what research sees, is that as people age, osteoarthritis gets worse, but that's because they're not doing the right things. Because what I see is we get people doing the right things, glute strengthening, and despite them getting older, they get better. So it's not an age-related problem. It's a muscle imbalance and pressure problem. If you have a bad muscle imbalance, it's going to put bad pressure in the joint. But if you fix that muscle imbalance, then it puts good pressure in the joint. If you're using that all the time, like when you're walking, doing your everyday activities, then the joint has a chance to heal. And it can be productive for you. If you're focusing on diet and nutrition to heal your hip arthritis, you're missing the point because it doesn't fix movement. You have to think about the way you move. You have to consider how you're walking. You have to think about your glutes firing. And just in case you're watching this for the first time, you've never seen me, what should happen when you walk is every time you bear weight on your right leg, as you're taking a step, your right butt muscle, your glute, should tighten up a little bit, like 20, 30, maybe 50% at most. And then as you shift your weight onto your left leg, your left glute should fire, and you should be alternating glute contractions as you're walking. And it should happen faster and more casual as you get used to it. And the prerequisite to do that, though, is that you have some glute strength, that you can fire your glutes, and that you can fire your glutes apart from your thigh muscles and your hip flexors. Because a lot of people have trouble with that. Their TFL right here, the front pocket muscle right here is just going crazy, wants to take over. It's one of the hip flexors too. And they can't fire their glutes without firing their TFL or their quads. That needs to be addressed in order for you to properly fix hip arthritis and alleviate the bad pressures in the joint, and then use your hip joint properly as you go through your life. Diet and nutrition doesn't fix that. All right, here's the next one. Guilt. If you struggle with weight, you probably have had guilt at some point about having that meal or that snack that you know you shouldn't have. Everybody deals with it, and it's okay. But what it can do for some people is debilitate them from moving forward on a program that's going to improve their health. And if you have hip osteoarthritis And now the reason for you to lose weight because the doctor told you, hey, you need to lose 20 pounds, that's not helping your hip arthritis. And you know that the foods you're eating aren't the healthiest, so it's bad nutrition and it's leading to inflammation, and your hip joint doesn't need that. You have this pressure on yourself, and then you go to that social event where it's your good friend or your family member's birthday or whatever it is you're celebrating for them. It's the holidays, and you have that favorite snack that everybody else has, that cake or that candy or whatever it is, and then you live with this guilt afterwards, and then you just throw it all out the window, especially if it happens a few times. You're like, screw this, I'm just going to give up and just enjoy life, be happy, have the foods that I want to eat. And then you have this inner tension that you're making your hip worse because you're putting bad nutrition in and you're not really thinking about your weight because you're just eating whatever you want. There's this terrible guilt that people live with. And if it's just 20, 30 pounds, you're probably here, maybe even here. And you don't need to be worrying about this. So you're going through unnecessary guilt about the whole situation. You don't have to stress out and feel this way when you're just a little overweight. Even borderline obese, overweight, you can probably still make a big difference because I'm giving you numbers here, but those numbers creep up gradually. You're not going to automatically be at 33.3%. And you might be at 40%, 50% muscle imbalance problem. You're going to make improvements if you fix the muscle imbalance, and you can deal with the weight later on as you become more active because your hip's feeling better. All right, I got a couple more that I want to share with you guys. Misplaced hope in vitamins and supplements. When you hear about the research on like chondroitin and glucosamine and MSM and collagen, hyaluronic acid, those are the most common ones. It can be exciting, and you hear about it and you're like, oh, I'm going to start taking this. I'm going to go buy the supplements at the store. I'm going to order them online. And, last week I did a talk about them and they can be helpful. But if what I said last week is, if that's your main plan is to take this bottle of glucosamine and chondroitin in order to fix your hip osteoarthritis problem, you have misplaced hope in vitamins and supplements. It's a tiny piece of the pie. If I could add that to this chart, it would be a sliver. It'd be like 1 or 2%. Maybe a little bit more for some people if your nutrition's really, really bad. If you don't eat any good foods at all, then it's probably going to be more a bigger slice of the pie. But there's still this big giant blue section in all three of these pie charts that I've made for you, where it's the muscle imbalance that you need to be worrying about, not the supplements and the vitamins. So I'm not saying don't take them. If you want to try them out and you have the means, because they cost a little bit of money, especially if you take them on a consistent basis, you're pretty much signing up for a subscription of supplements. But that's okay. You can do that. And I think it's good. It's a good thing overall. You just can't do it with the expectation that it's going to solve the full problem, because it doesn't do that. So have a good understanding of how supplements work for hip osteoarthritis. And then the final thing that I have for you here, number 7, we'll start taking some questions here, is this fact. Healthy people still get arthritis. OA. Happens. And what I mean by healthy, like I have people coming into the clinic here. Since I started my career, I have met people that are at a good weight, thin, have some muscle on them, eat right. They're making an effort, they're making an effort to be health conscious. They tell me they drink bone broth, they, go walk and exercise. They've been trying to tick the boxes all their lives, following all the advice from doctors and the best health experts out there that they had access to. And they still got osteoarthritis. They still got pain. For me, what that tells me, because when I get a hold of them and I start talking to them about the muscle imbalances being the main problem, the mechanical problem, they're usually like, oh my gosh, that blows my mind. I can't believe nobody ever told me about that. And that's usually the missing link, because for that person, Their chart looks more like this, except the red and the yellow sections are even thinner than they are here. It's mainly a mechanical problem. And once we can get a hold of that, once we can get control over the mechanical problem, we get their glutes working right at the right time, in the right activities, and they can do it in a variety of different ways. Their glutes fire consistently and they have good strength in them. They've solved the problem. And that to me just proves it that it's not age. It's not 100% diet or nutrition. That's just a factor. The muscle imbalance is by far the biggest thing that people need to worry about most of the time. And so if you have a weight problem, if you feel like your diet isn't great and you have a nutrition inflammation problem, it's good that you acknowledge it. That's why you're probably watching this video, but you still need to think about the full picture. Work on the muscle imbalance. Make sure you address that. And only if you're in this obese to severely obese category would I say, yeah, you need to prioritize your diet and nutrition. That's actually going to have a bigger impact on you. But if you're overweight or normal, you probably need to be working the muscle imbalance. And that's going to have the biggest impact on you moving forward in healing your hip arthritis. All right, guys, I got about 20 or so minutes for some questions. Let's see what you guys got here. First one is from Staying Alive. He says, only when I have been laying down for sleep do I get terrible pain in my hips. What is wrong with me? Thank you. Oh, that's a good question, Staying Alive. People that get pain at night when they're trying to go to sleep, they usually have pain during the day, but maybe they're just not tuned into it. That's my thought is, when you're awake during the day, you have input, you have lights hitting you, you're talking to people. There's just things distracting your mind, and you might have some low level of irritation and pain. But when you go to sleep, all the lights turn off usually, noises go away, and your nervous system can now pick up more subtle things happening in your body, like that irritation. Plus the position that you're in, if you're lying on your side, you might compress the joint because, I'll get a swig in a second. If this is your right side and you lie on the hip, it's going to add more compression to the joint. If it's already compressed because you have that muscle imbalance, it can irritate it a little bit more. So those factors need to be considered whenever you're going to sleep. I wouldn't worry as much about sleeping position. I mean, you can. I would put a pillow between your knees, lie on your back if you can, maybe even your stomach if you can. I know I get questions about all the time. You're okay lying on your stomach? Yeah, it's as long as you can breathe and it's not uncomfortable for you lying on your stomach. It's not a big deal for those of you that are stomach sleepers. But the better long-term solution so that you can sleep better is fix the muscle imbalance, because then you'll have less irritation and you'll be able to tolerate lying on your side like you could before without it aggravating your hip joint. So fix the long-term muscle imbalance. That's the take-home message there, and you'll sleep a lot better. Next question here is from Brendan Connolly. 34 years old, started 100% offloading weight 6 weeks ago for what MRI said is mild chondro, so probably chondromalacia patella. Still very sensitive and swollen, feels like not much progress made in cartilage healing. Is this normal? Feel defeated. I'm so sorry, Brendan. Yes, that happens. And so the offloading is going to help because now you're not putting your full weight through your leg and aggravating it. But what could be happening is your muscles are so imbalanced that even without putting weight through your leg, your quads are pulling your kneecap against your thigh bone, and that's enough to irritate it. It's already irritated, so it's not going to take much more to continue to irritate it. So what I would make sure you're doing in addition to offloading is massaging the quads to let some of the tension out of there, and then also training your glutes, getting your glutes to be active. And you don't have to be putting weight through your legs to do that. You could be lying down on your back and just activating your glutes and thinking about not activating your quads. That's an excellent place to start at in your situation. That way, you're not offloading, so you're taking pressure off the joint that way. Loosening up the muscle the quad muscle is gonna take pressure off the kneecap, and so that takes care of the short term. Then the long term is get those glutes working so that the quads aren't compensating, and that sets you up to have that more long-term relief. So those are the three things that I would work on right away. All right, who's next here? Kimberly's here. Kimberly says, I broke my femoral neck last year. So that's this part of the bone on the thigh right here. It's at the where the bone shifts into the ball and socket joint. And she says, I have a plate and 5 screws. Okay. I was told I'll probably need a hip replacement someday. I'm so sorry. I feel like there's always something pinching there. Come on, glutes. Yeah, that's possible. That the plate and the screws, they just take up space in your body. And the doctors these days, the surgeons that do those, they're amazing. And they have plates and screws that are very low profile, but the fact of the matter is that's not something that's supposed to be in your body naturally. But of course, it's been good because you had a fracture and it's able to keep everything together. But there's often reports of patients that I've worked with where they say, like, I can feel that the metal's in there, that pin's in there, the screw's in there. They just have a sensation that something's there that's not supposed to. And that's a side effect of having the surgery. So as long as it's not debilitating, it's not like keeping you from doing things, it's not causing a lot of pain, it's going to be something you have to tolerate. Now, if it is something that's stopping you from doing things that you need to do and is painful to the point where you can't sleep, you can't function, then you're gonna have to talk to the doctor and see what solutions they have for you. And it might mean taking it out, which is going to be invasive, but it might be worth it if you can't do what you got to do. So best advice is let's see how you can tolerate it. If not, go talk to the doctor. All right, Brendan's back. He says chondromalacia in both knees requiring weight offloading because of the swelling and sensitivity. How to manage on crutches without a good leg. Oh, both legs. Sorry, Brendan. So yeah, it goes back to massage your quads. You need to get one of those massage guns. I don't have one handy with me here, but I'm sure you guys have all seen them. It's got the different attachments you can put on, looks like a drill, but the intent is to massage your muscles loose. And if you put that all over your quads right here on your thighs, both sides, find the knots. I've got videos all over the internet about this, and work on those knots. You'll feel the muscle loosen up. And at first, the knots can be a little tender and uncomfortable, but after 20, 30 seconds of working on it with a massage gun, it kind of melts away. It might take a little bit longer if it's the first time you do it, but it usually decreases the pressure at the knee joint and can give you some temporary relief. It's mechanically beneficial because it takes pressure off the kneecap where it interfaces with the thigh bone. So I'd go get one of those guns if you don't have one and start working on that, and then activate the glutes. People saying hello. Here we got Donna Harris is asking, can I use a rebounder Bellicon with hip arthritis? I'm not a big fan of the rebounder. There was a couple studies done on the rebounder, and that's not enough in my opinion. And I think that the way the studies were done, I think the ones that I saw were on knee arthritis, not hip arthritis. But even then, knee and hip arthritis are extremely related. Same muscle imbalance that affects both problems. What my tension with it is that it doesn't activate the glutes automatically. You have to consciously do it. So if you can get your glutes to work while jumping on the rebounder is a tiny trampoline. For those of you guys that don't know, it's like a personal trampoline. And the point on the way that they're using it in rehabilitation for osteoarthritis is they have people bouncing on it, jumping in place. And the idea is that you're getting your muscles to work, and somehow it's supposed to fix arthritis. But what I tend to see people do is use their quads more. The muscles that are already dominant, they just use them more because it's a more intense activity than you probably normally do. And it feeds into the imbalance long term. Now it's a new motion. You probably haven't been jumping on a trampoline if you've been dealing with hip arthritis. So because of that, it might feel good to do something new. Some people get pain right away, but some people are like, oh, this is fun. They have this, positive outlook on it because it reminds them of their childhood, or they see their grandkids doing something like that, and it's fun. But in the long term, it's feeding into the muscle imbalance. So I don't think it's a good long-term solution. Okay, if you try it out, see if your glutes can work on there. And if you can get your glutes to consistently work, then it could be something you can do on a regular basis. But if it's not activating your glutes and you're not fixing the mechanical problem, you're not working on the blue part there, you're actually worsening it. Hope that helps you, Donna. Next up, we got Ann Garcia. She says, you've got me and my boyfriend moving for stronger glutes. Yes. Thank you so much. He may have a torn meniscus, MRI on the first, but I'm still sharing all this information with him. Well, thank you for sharing this, Ann. Yeah, meniscus is not fun to deal with, but it can be helped. And more importantly, what I think about with people that have a meniscus tear, is that you're at higher risk for developing knee osteoarthritis. So it's important for you to fix the muscle imbalances that led up to this tear now, especially if there was a non-traumatic tear, like there was never an accident, you just started having knee pain, it started to swell, and things got worse over time. That's the type of meniscus tear that happens from a muscle imbalance, very, very likely. Even the traumatic ones, I think, often happen because of a muscle imbalance. But if you didn't have like a car accident or a bicycle accident, something like that, a sports injury, then you definitely have a muscle imbalance. But I would push hard to fix this without surgery, because what some of the more recent research is showing is that if you have a meniscectomy where they cut out a chunk of the meniscus, there's a high chance you're going to develop arthritis really fast, like faster than normal, because they're taking out a chunk of the meniscus. It might still help you even though it's torn. Of course, if it locks, if your joint just isn't working right at all, like every day you're running into problems with it, like it locks up on you, surgery is probably necessary for meniscus. But if you have good motion, it just hurts and it swells, then there's things that could be done where you can make tremendous improvements and probably feel 100% fine and very healthy to go do activities, running even. You just got to fix that muscle imbalance. So charge on, Ann. You can do this. And Ann's boyfriend, come on, you guys got it. All right, we got about 10 minutes left here. Let's see who's next. Going through some other hellos in here. Patty Lynn says hello from Wisconsin. Logger in Camp is in British Columbia, Canada. How's it going? We got Donna Harris again. She says hello in Montreal. I answered a question about the rebound already. Fantastic in Montreal. We got Tina Castillo from Fort Pierce, Florida. Florida's in the house. Fantastic. We got Debbie Lundeen from British Columbia. Hi, Debbie. And then Leela says bogas. I'm not sure what that is. Kimberly's got another question here, or comment. She says, Dr. Davey, you always have great information for us. Thank you for helping us all out. Greatly appreciated. You're welcome, Kimberly. Thank you. I appreciate that. That warms my heart when people thank me, because this is work. It's work for sure. But I'm happy to do it, and it just charges me up when people say thank you. I appreciate that. Mountain Girl and Bunny says, question, 50 years old, obese from years of undiagnosed Ehlers-Danlos hypermobility, hip, knee, SI joint, and cuboid foot issues. Oh my goodness, medication hasn't worked. Watching lots of your videos. What do I focus on? All this is good. Ehlers-Danlos syndrome is a syndrome. It's a condition where your connective tissue is very loose. And so like ligaments and tendons are very loose. And so these people are very flexible. I think contortionists probably have some of this going on. People that can touch their foot to their head from the back and do all kinds of crazy moves, like the people you see in the circus, that kind of thing. I'm not saying, I don't have any implications. I'm just saying that's what you see. I've seen many very normal people that have Ehlers-Danlos. It causes like heart conditions too, because of the connective tissue problem. But my advice with people with Ehlers-Danlos is always your muscles still work, obviously, right? You're walking around, you're living life. You need to have very strong muscles. I would probably look to get into strength training, bodybuilding, be a regular in the gym with weightlifting. I mean, that goes for everybody. Everybody should lift some weights to some degree. Some people are definitely more slanted towards doing cardiovascular exercise because they just have that slender build, that marathon runner type build. If that's you, then by all means go run, but you should still be in the gym lifting some weights from time to time. But then other people have a more full frame like myself, and I'm just slanted. I'm built to kind of lift weights. If you have Ehlers-Danlos syndrome, you just need to lift weights, because if you don't have good strength in your muscles, your ligaments are going to be loose, and you need that extra tension from your muscles so that your joints are behaving properly and you're not getting problems down the line. So go hit those weights, get yourself a trainer, get yourself some sort of education. If you don't know, get over your concerns, your fears, your worries about lifting weights, and you just need to be strong. There's no other way around it. It's not like Ehlers-Danlos syndrome is not a like a sickness that you contract. It's not it's genetic, so it's not something that you what's the word I'm thinking of, where somebody else gets it. Contagious. It's not contagious. So it's something that you're going to have the rest of your life, and you just have to figure out how to manage it. And one of the best ways is to just gain strength and then maintain it. And I would look to just keep gaining strength as the years go on. All right. Leela says, me, T. True. Donna Harris asking about the rebounder. As long as, okay, so can rebounder help improve hip arthritis as long as it has a soft landing? Goes back to the glutes, Donna. The landing, if the landing does not tire out your glutes, if the rebounder does not tire out your glutes more than anything else, don't use it. That's the bottom line. Don't use it. I don't care what medical research studies are out there. That is, I get irritated about this. Now, I'm not mad at you, Donna. It's just like the way that these things are portrayed. There's a study or two out there, and all of a sudden it's like, oh, this is going to heal knee arthritis. It takes off. The news picks it up, and people run with it. And people like you, Donna, you may not be medically trained, and you have questions like this. And it just comes back to which muscles are working when you use the thing, when you do the exercise. If it's not glutes, it's not going to help you. You can try it out. By all means, try it and see how it works. All right. Shadat Patwary says, hi, with glute contraction, the IT band on the side gets pulled or hard. Is it normal? Sometimes hamstring with quad also contracts. Is it normal? Thank you. Good question here, Shadat. That sounds like you have a compensation. Like when you try to activate your glutes, your other muscles like your glutes, your hamstrings and quads are also contracting. And then the IT band is a piece of connective tissue on the side of the hip. It starts up here in the hip and it goes down to the side of the knee. But there's a muscle that connects to it called the TFL muscle, tensor fascia lata. And that TFL muscle loves to compensate when there's weak glutes. So what you need to do right now is slow down in how intensely you're firing your glutes, and you have to be in your head. You have to be thinking about getting your glutes to contract while keeping your thigh muscles, including that hip TFL muscle on the front, the one that connects to the IT band, keep those calm. Keep those not working. Figure out what percentage you can tighten your glutes before the other muscles work. So in other words, like let's say, do this with me right now if you can, stand up, tighten your glutes 10%. And hopefully your thigh muscles aren't working, the front of your hips aren't working. And then see if you can go 15 or 20%, 30, 40, 50%. Usually around there is when the other muscles start to work. Find that threshold and then back off a little bit. If it starts to fire at 50%, then go down to like 45, 40% and hold your glutes contracting there. 10 seconds and then relax and then repeat. And the goal is over time, maybe not today, all in one day, but over a few days, you can go from 45% contractions without the thigh muscles working and the TFL muscle working to 75% and eventually 80, 90% and beyond. If you can get your glutes to work at 80, 90% intensity without your thigh muscles taking over, you just open a whole new world. You're going to strengthen your glutes a lot better. And it's not going to feed the muscle imbalance. It's going to benefit you. You got to figure that out. It is, when you ask me the question, is it normal? It's common. A lot of people have this compensation, but I don't think it's normal. It's not the way the body's supposed to work. You should be able to fire your glutes without a bunch of thigh muscles working. Definitely the TFL shouldn't be working. All right, I'm going to take one more question here. OSC.U76 says, hi from Spain, hip arthritis here, grade 3. Doctor suggests surgery. After exercising glutes and femoral, I am impressed with the improvement. Thanks, doctor. Fantastic. You improved. I love this. It warms my heart. That's like the other comment that I got from Kimberly. I appreciate you guys letting me know. This stuff works. See what this person did here is they focused on the muscle imbalance and it improved. You got to get those glutes working right. You got to figure out how to separate it from your thigh muscles and your hip flexors. It's not a passive thing. You know, if you think about this, most hip osteoarthritis treatments out there are passive treatments. It's take this pill, get this injection, show up for surgery, we'll handle the rest. You'll wake up with a replaced hip. You don't have to do much afterwards. You got to do a lot of rehab, but they don't talk about that too much. They're like, oh, in 2 or 3 months you'll be just fine. You'll be walking, maybe even dancing. You know, it's that kind of response. But in reality, you suffer for months after the hip replacement. It's not easy. And then if you have the muscle imbalance, you're still going to have problems potentially afterwards. So the way that the way that I'm telling you to fix this hip arthritis problem, my treatment approach is by fixing the mechanical problem, the muscle imbalance. You can avoid the surgery, but it takes some action. It's active on your part. It's not passive. You have to think about this stuff. You have to push to a new level of growth. You have to fully understand this whole process. And it's not beyond you. But if you can figure this out, you're going to reap the benefits, and you're going to enjoy your life so much better because you can do things. And it's not just surviving. It's not just like, I survived hip arthritis and now I don't have hip pain. I don't need a surgery, but forget it if you ask me to walk more than 10 minutes. That's not a way to live. Fixing it this way, you're going to thrive. You're going to say, I can walk an hour plus. Yeah, let's go hiking. Yeah, I'm going to keep up with you. It's going to be that kind of response because you're going to have the strength and the coordination in the glutes on the back of the hip, and you're going to be able to keep up with everybody. All right, guys, there's so many more comments. I'm so sorry I didn't get to everybody. I hope to see you guys here next week, and jump on, start asking questions early. And I appreciate y'all showing up and saying thanks and asking your questions. Bye, guys. See y'all later.